So briefly here, we'll be looking at examples of drugs that we can use to actually inhibit eicosanoid synthesis. That's basically like the formation of the different types of eicosanoids, right? So there are some drugs that you can use to actually control the actions of eicosanoids by preventing the making of new eicosanoids, all right? And what are eicosanoids? Eicosanoids are potent chemical messengers that have well-established roles in regulation of inflammation, immunity, and platelet aggregation, okay? So if you find out that maybe the actions of eicosanoids in the body are getting out of hand and you want to actually control it, I mean, they mediate all those inflammation, immunity, and platelet aggregation. So if it is getting out of hand and you want to control it, then you have to use some drugs that inhibit their synthesis, right? So we'll be looking at examples of these drugs and basically their application, okay, to what eicosanoids synthesis, okay. So now we'll be looking at it was an exam question, so I'm actually reading it directly. Discuss briefly with suitable examples the clinical use of eicosanoid synthesis inhibitors. Okay, drugs that tend to actually block the formation of these eicosanoids. I could see a whole lot of drugs here. All these ones in red. Okay, all these ones in red basically block the formation of eicosanoids. All right, so let's go in. The first drug we have is not really a drug, okay, but just trying to look at the availability of factor. Okay, now since phospholipase A2, this is phospholipase A2, right? So since this phospholipase A2 is activated by calcium and calmodulin, okay, it may be what inhibited by drugs that reduce the availability of calcium. Okay, so any drug that reduce the availability of calcium at all will have an effect on what phospholipase A2. Okay, and next we'll be looking at the second one. We said that glucocorticoids block all known pathways of eicosanoids metabolism indirectly by stimulating the synthesis of what annexins. So these annexins are being um, produced, okay, due to the stimulation from what glucocorticoids, or you could call them corticosteroids. All right. So now, once the annexins are stimulated, you see where they act on the pathway very up. Okay, so once they act at this side, anything down here will not function again. All right, that's why they say that they block all known pathways of eicosanoids metabolism indirectly by stimulating the synthesis of what annexins, which inhibit the enzyme phospholipase A2, thus preventing the synthesis of what arachidonic acid. All right, because arachidonic acid gives rise to all those other eicosanoids that we know. All right, so moving to the next. Okay, so we said that also they regulate the expression of cyclooxygenase 2, but they do not regulate cyclooxygenase 1. Okay, that's another added advantage. Moving to the next, we say that non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, they block prostacyclin effect on what lipoxygenase pathway. Okay, so aspirin, you could see this aspirin. All right, that's where they act, and they block prostacyclin effect on what lipoxygenase pathway, and this is what prostacyclin. Okay, so moving to the next now, we said that drugs like what ninocelid, Celioxib, retocoxib are selective inhibitors of what cyclooxygenase 2, but they have no effect on what the cyclooxygenase 1. Okay, right? So you can see this is where they will act. Okay, although they are not labeled, okay, but you know that from the arachidonic acid down here, for the prostaglandins to reproduce, the cyclooxygenase enzyme must have to act on that pathway. Okay, so these drugs tend to actually block it at that side. Okay, and they act more on the cyclooxygenase too. So moving to the next drug, we said that dazodidem, the selective inhibitors of what thromboxane pathway, right? Where the thromboxane pathway, this is thromboxane pathway, okay? And the drug, you see this enzyme, thromboxane synthase, okay? So the drug dazodidem, okay, will basically inhibit the formation of a thromboxane, all right? So moving to the next, this should be the last slide. We said drugs like what? Celecoxib and rofecoxib are selective inhibitors of what? Cyclooxygenase enzyme. Cyclooxygenase 2, okay? So they too will act at this side. Do I have it here? Okay, yeah. This is a cyclooxygenase 1 and cyclooxygenase 2, okay? So those drugs too will act at this side and prevent the production of what? Prostaglandins, prostacyclins, and thromboxanes. Okay. And we said that selective inhibitors of 5-lipoxygenase pathway include what? Zileuton, which was used in the management of what? Asthma. Now let's look at this Zileuton. You see the Zileuton, all right? Selective blocker of 5-lipoxygenase pathway. And this 5-lipoxygenase pathway will lead to the production of what? Eicosanoids such as what? Leukotrienes and liposines and the HATEs. Okay, so that drug will actually block that pathway at that very side. Okay, so also we have cysteine leukotriene receptor antagonists. Okay, these drugs include what? Zafirlukast, Prednisone, and Montelukast. Okay, they are used in the management of asthma also. Okay, they will block cysteine leukotriene receptors. Okay, so basically they will antagonize it. Okay, so that it will not be able to be receptive to leukotrienes. Okay, thereby regulating asthma, because all these asthma, all these other reactions that we mentioned have to do with either inflammation or your immunity or your platelets reacting to an infection. Okay, and it could be that maybe they are reacting too much, not really an infection though, it could be an allergic response. Okay, so that's how we can be able to use these drugs to be able to what? Block the synthesis of carcinoids in the body. All right, so that's it.